The second is don't try and game the system. Like, oh, like I think they're going to rank me highly, so I'm going to rank them highly. Like, don't do that. The reality is the match favors the candidate, right? Like, let's say you really want to come to Toronto, but you don't think you performed well in your interview. And on our side, we're like, yeah, didn't perform well, great on the interview, but we're still going to rank you like number 25, right? If you rank us number 1 and we rank you number 25 and our top 24 have no interest in coming to Toronto, like you're going to get to come to Toronto, right? Because the match is meant to favor you as the candidate, not us as the program.
Mm-hmm. Welcome to Specialty Café, a podcast by the Royal College that enables you, medical learners, to choose your ideal specialty. My name is Mark Garabedian, a fourth-year medical student at McGill University, and I'm thrilled today to continue our CaRMS series with Dr. Kaif Pardhan, who is the Emergency Medicine Program Director at the University of Toronto. Welcome, Dr. Pardhan.
Thanks so much for having me.
Yeah, thanks for joining us. Could you maybe tell us a bit about your path into emergency medicine, what kind of drew you to the specialty, and maybe your career journey through residency and afterwards?
Yeah, absolutely. So I did my medical school training at the University of Manitoba. Initially had no plans to go into emergency medicine. The original plan had been to do a pediatrics residency. And over the course of my clerkship rotations, realized that I pretty much liked every single rotation that I was on. Really enjoyed the medicine, really enjoyed the patients that I was working with, as well as the consultants and residents from each of those services. And so I came to emergency medicine as a choice quite a bit later than I think some of my peers. So I decided on it in the summer of clerkship. So I'd already done 6 or 7 rotations by the time that I'd made that decision. Mm-hmm. So had some sort of brisk last minute elective changes. And this predates the AFMC electives portal. And so it was a lot of emailing of individual schools to get things moved around. And so I ended up splitting my electives pretty equally between pediatrics electives and emerge electives. Was very fortunate to be able to interview for both disciplines, and was extremely fortunate to match to the U of T Emerge program. I think one of the things that I tell all of the candidates who are applying to U of T, because they often want to know, like, how many electives do I need to do in Toronto in order to match there? And I jokingly, but not jokingly, tell them, like, I didn't do any electives in Toronto and I still managed to match here. And so I think it's helpful for folks to know that. Like, we know that getting electives can be quite challenging, and I would reassure you that getting an elective in the city where you want to do your residency training is certainly not a requirement. So I did my 5 years of Emerge training at U of T. And during that time, did a fair bit of work with PARO, which is the Professional Association of Residents of Ontario, as well as what is now called Resident Doctors of Canada, or RDoC. We changed the name during my residency. And then after that, I started working. I started working at Sunnybrook, which is a large emergency department in Northern Toronto, one of the largest trauma centers in Canada, and did the bulk of my clinical work there. But I also maintained a pediatric practice, really just to keep that pediatric interest well sated. And so have been doing between 4 or 5 shifts a month at McMaster Children's Hospital, really for the duration of my practice. And so that's sort of been my practice journey. And I started in this role as program director just over 4 years ago now.
Awesome. And so you were kind of able to incorporate that interest in peds that you kind of held throughout medical school into your emergency medical training.
Yeah, that's exactly right. And I think one of the things that I would say is emergency medicine is one of the disciplines in medicine that is truly a cradle to grave specialty. And so we're fortunate that throughout our practice, we will always be seeing children, regardless of what hospital site we're working at. And we'll see that all the way through to the end of life awesome. For our patients. And so it's a really great way to maintain your skill set throughout the spectrum of practice.
Awesome. Maybe looking back, you mentioned a little bit about your own residency application and your process there. Were there any lessons that you learned yourself kind of transitioning from a med student to a resident and looking back, maybe assessing applications as a resident?
Yeah, that's a great question. I think the message I would say on that front is that more and more programs are becoming very explicit about what they're looking for in a candidate's personal statement. And that's really where the meat of like why a candidate wants to be part of a program is. It's in that personal statement. There are some programs where it used to be quite vague, like write 750 words about like why you want to come to this program, and that would kind of be it. But on the back end, there would be all these criteria that they were expecting you to meet in that personal statement, and they weren't super explicit about it. I would say that's changed for the better. I think most programs are really quite explicit on the CaRMS website. Like, this is what we want you to write about. And I think my counsel to candidates for residency programs, both as a resident and now as a program director, is if you follow the instructions that the program gives you, that's likely the criteria that they're assessing you against. And so making sure that you're addressing all of those points in your personal statement, I think will be really helpful to you as a candidate applying to that program.
Awesome. That's very good to know. I think it benefits people like me who are now kind of going through the cycle to have that clarity and not trying to guess. Maybe now shifting from your role as an applicant to maybe your role as a program director, what do you see as the most important parts of the residency application overall? What kind of among, CV, MSPR, personal statements, reference letters, are there any things that you weigh and your committee weigh more than others?
Yeah, that's a great question. I think the short answer is that there's no one thing that makes an application stand out. Like, we really try and be quite holistic in terms of the way we approach applications. So, the personal statement is really your opportunity as a candidate to tell us who you are, why you want to do this discipline, why you want to come to Toronto or insert city here in terms of why you want to be in that place. The CV really gives us a sense of what you have done outside of your training, right? So outside of your core, like coursework in first and second year med school and your clerkship in your third and fourth year, like that's really your opportunity to tell us what you've done outside of that. But we also recognize that a couple things. One is that some very high level commitment things that would show up on your CV. So, for example, a high level athlete, for example, or someone who is engaged in high level leadership, either in or outside of medicine, like that can be quite time consuming and might preclude you from doing other things. And so we really want to make sure that it's not just about the breadth of things that are on your CV, but the depth. And that really does come through in terms of how you describe the activity that you participated in. The second thing that we look at is there are medical students whose life circumstances preclude them from engaging in what we call traditional CV building activities, right? If you are, for example, the sole breadwinner for your family, if you are required to provide either childcare or elder care, that might prevent you from being able to do 2 or 3 research projects and volunteer at 3 or 4 community agencies. And so we also don't want to disadvantage folks who might be otherwise extremely competitive applicants. And so the CV, there's like the standard CV, there's the CV of the person that does like 1 or 2 like really intense things, and then there's a CV for folks who can't engage in those activities. And all of those things are valued by the training program. And so like one thing on your CV is going to be the thing that says, yes, those are the candidates we want. We really are looking for a diversity of candidates that will make really great residents once they're in the program. The MSPR, you're going to hear lots of different perspectives on the MSPR. It's quite a challenging document, I think, for any residency program. The candidates have a lot of oversight over what is and is not included in the MSPR. But fundamentally, what we're really looking for is, people who want emergency medicine are going to perform well on their emergency medicine rotation as a general rule. But really what we want to see is like, what did you do on all of your other rotations, right? Did you phone it in on like OB and general surgery? Because we really want people who are going to be engaged in every rotation of residency, because everything in medicine is relevant to emergency medicine, other than maybe pathology. But like the vast majority of rotations and disciplines are relevant to emerge. And so we really want folks who are going to be engaged in all facets of their training. And then reference letters, of course, are very valuable, right? We definitely want to hear the perspectives of people who have worked directly with you to see fundamentally if you're a good fit for the discipline, and that you've demonstrated the things that we're looking for. Good work ethic, teachability, humility, great interpersonal interactions, both with patients as well as with consultants and with supervisors. So those are certainly the types of things that we look for in a reference letter. And so that's what I mean when I say we really look at the whole package. There's no one part of the application that stands out over and above the others.
Yeah, I think, the holistic point of view definitely is, hopefully the new way of thinking for, and, looking at all aspects of of a potential resident as opposed to just, how many publications did they put out last year?
Yeah.
Yeah, so that's very good to know. Is there any things that, that you've seen that might be cause for concern, things that applicants should avoid, red flags?
Yeah, so I think, in terms of things to avoid, and this is specific to the CV, like the CV should be truthful. I think it would be very unfortunate if a candidate were to be caught putting something that's inaccurate or false on their CV. Like I think that's when you talk about red flags, that is a firm red flag. Like that is someone where if it was discovered, we frankly would not even interview them. We would say just not even going to put them on the rank list for interview or subsequently. But I think I'll come back to what I said earlier, which is the programs tell you what they're looking for in a personal letter. And so you really want to make sure that as a candidate that you're addressing each item or each question that a program is asking you. And some programs, say, we don't really want an essay. We just want you to answer these 6 questions. And some programs will say, write a personal statement, but in that statement, please address these 6 points. So if you look at the U of T's CaRMS description, that's what we ask for. So we say, please write a personal statement, 750 words in length, and please make sure you're touching on these 7 points. Because those are the things that we're looking for. Those are the things that we want to hear about from our candidates. From a CV standpoint, like be true to yourself, right? Like if there are things that you think are really important and meaningful, those are the things that really should be highlighted on your CV. CV padding, I think, it's important that you talk about the things that you've done, but like breadth is I think on balance less important than depth and demonstrating that you have commitments to things outside of your training program.
Awesome. It's very good to know. Do you think that there are maybe qualities that make someone particularly suited or qualities that you look for in applicants who are applying to emergency medicine compared to other specialties?
Yeah. And again, I think there's nothing secret here, right? Like I think this is all well articulated on our CaRMS description, but fundamentally it's diversity of interest, teachability, humility, strong work ethic, good communication skills, good collaboration skills, and an ability to advocate on behalf of your patients and your community. Emerge is a diverse, fairly fast-paced discipline where you're working in an environment that is often suboptimal. Our moniker is very much anytime, anywhere, anyone, because that's kind of how we roll. And so we're really looking for folks that are able to thrive within that environment.
Okay. Awesome. And maybe like a topic that I'm definitely very much exposed to now among my peers is research. Everybody wants to get that last publication out before CaRMS is due so that they can switch it from, in preparation to in submission on their CV. And everyone's very stressed about that. How important, and I understand that, research might be more important for certain specialties than others. When it comes to emergency medicine, how highly do you rank research? How important is it? Is it a crucial aspect?
So research is one of those things that, at least in our program, I can't speak to the other EM programs across the country, but is one of those things that is on a pedestal, but the pedestal is the same height as a bunch of other pedestals, if that makes sense, right? Yeah. So, when you think about a CV, the way that I think about it very much is like there's leadership activities, there's employment activities, there's research activities, and then there's high commitment other activities. So like we were talking about earlier, like the high level sports, right? And so if someone is a star researcher, is that something that we look for? Absolutely, right? Like if this is someone that is going to become a clinician scientist or a clinician investigator at the end of their training, they're going to be the next, big resuscitation researcher, or the next big quality improvement researcher. That's fantastic. That's exactly the person we're looking for, right? But that's not to say that if someone is going to be, the next I don't know, president of the Royal College, or, president of the OMA, or
Hmm.
high caliber political operative, right? Like that's also something that we value, and that we would value likely at the same level as being a high level researcher. So like I said earlier, fundamentally we want a diversity of interests and candidates and fundamentally residents in the group, because that's what makes for a more enriching training environment.
Awesome. Okay. Yeah, it's, again, coming back to the holistic point of view, I think that's very important, and really benefits students that are applying to the match this year and in the recent and upcoming years.
Mm-hmm.
Um, Maybe shifting over to kind of electives and planning for CaRMS, what advice would you give to students planning electives in emergency medicine across
Yeah.
the country or within a certain school?
Yeah. So let me say up front, I recognize that getting electives is kind of like the Hunger Games. And so it doesn't matter what advice I give you, like some electives you're going to get and some electives you're just not, right? I
Hmm.
understand that. And I think the truth is that it doesn't matter what discipline. I think every program director understands the stresses of getting electives for
Hmm.
students. So couple thoughts. Number one, we as program directors know you can only do 8 weeks of electives in any single discipline. Like we understand that. I think the benefit or beauty of emergency medicine is that you can make almost any elective relevant to emergency medicine, right? So we definitely want to see that you have done some additional emerge beyond your core emerge rotation. And if you haven't been able to secure an elective outside of because we know it might happen, right? If you haven't been able to secure an elective outside of your core EM rotation, just make sure you talk about that in your personal statement, right?
Hmm.
Like, I really wanted to do an emerge elective, but like I did my emerge in block, I don't know, 7, and I realized I loved emergency medicine. I couldn't get one, but this is why my ICU elective and ortho elective and gen surg elective and plastics elective are relevant to my interest in emergency medicine, right? So really being able to link the electives that you did with the discipline that you want.
Hmm.
And then, like I said, like at the very beginning, when we were doing the intro, where you do the electives, frankly, is less important, right? Like we recognize that sometimes getting the city of your choice for electives is impossible. So don't let that be the thing that you sweat. There's lots of things to sweat in CaRMS. I would say that should not be one of them. Some programs, both within emergency medicine and outside of emergency medicine, will give some extra credit if you're able to do an elective at their site.
Hmm.
I will say the U of T has very specifically not done that because we recognize that getting electives in our center can be quite challenging.
Right. Okay. Awesome. Good to know. And kind of off on that note, given that it's maybe a little bit difficult to establish a working relationship with an ER staff, since, students are kind of working with multiple staff throughout the rotation.
Mm-hmm.
Do you have any advice for students who are interested in emergency medicine, looking to get reference letters, looking to stand out, things like that?
Mm-hmm. Mm-hmm. Yeah, it's a great question, and something I think we all struggled with when we the staff were applying to be residents in Emerge. Like we've all been there. We've all had those awkward conversations. So the truth or the reality is that most emerge docs know that they're only going to get to work with you 2 or 3 times before they're asked to write you a letter, and that's almost always sufficient, right? The reality is you're spending 3 shifts. Most of the shifts are 8 hours. You're spending 24 hours with this person. You usually have a pretty good sense of their work ethic and teachability within that 24-hour time span. The one thing I would counsel all of the candidates, though, is if you get 2 letters from people where you've done sort of 3 or 4 shifts with them or 2 or 3 shifts with them, you should try and make sure your 3rd letter comes from someone who knows you very, very well. Because that really comes through in the letter, right? The supervisors will say, I worked with this person for 2 or 3 shifts. I thought they were awesome. They were teachable. They had a great work ethic. But when someone says, I've known this person for 2 years and, I've watched them develop as a physician or as a medical student, they've gone from like a super eager, keen, pre-clerk to excelling in all of their clerkship rotations. Like it really comes through as a different level of letter.
Right.
And so if you can get someone, like if it meets the requirements of the training program, if you can get someone who knows you really, really well and can really comment on some of those qualities, that I think is all to the good for you as a candidate.
Is there a certain maybe way that you and your colleagues like to be asked for a reference letter? And that's definitely something stress inducing for me, especially after maybe not working with the staff for too long, going up and having that type of awkward conversation that you described.
Yeah, it's a great question. There's like the what's the word I'm looking for? The way you would ask it on paper, and then of course there's the real life of it, right? But fundamentally, the thing you want to say is, some version of, I've really enjoyed working with you. My career goal is to apply for emergency medicine. Would you be willing to write me a strong reference letter based on our time together?
Right.
Or something along those lines, right?
Mm-hmm.
Because number one, you really want to tell them, this is what I want to do with my life, right? Because that's helpful for them to hear. And hopefully that's come out in the time that you've worked with them, right? Like if you're doing an elective with someone, because I'll ask all the students I work with, I'll say, hey, like, what's your life plan? And, whether they're elective or not. And sometimes elective students will say to me, yeah, I'm planning on doing internal medicine, but Emerge I thought would be really helpful for my application. I'm like, that's great. Mm-hmm. Let's focus all of our teaching on what's going to be relevant to you as an internal medicine resident. Versus, if a med student says, yeah, I'm planning on being I really want to be an Emerge resident, then I'll say, okay, let's make this as awesome an Emerge elective as we can, because that's what's going to set you up for success when you're a PGY1. And so usually, hopefully that conversation has happened beforehand. And then at the end, you can say, hey, I want to do Emerge. I hope you've had as good a time working with me as I have with you. I was wondering if you'd be willing to write me a strong, and that's the emphasis here, a strong reference letter. Because if they have not had a good experience with you, the last thing you'd want is somebody writing you a terrible letter.
Yeah.
And I would say like most Emerge docs will be honest with you and say, yep, more than happy to write you a really strong letter, or, I might not be the right person to write you a letter for CaRMS.
Yeah. And, just going back to that, I do remember working alongside you at Sunnybrook while I was on the ortho team and you were on the Emerge side, kind of providing sedation for one of our patients. And I remember having that exact conversation with you, asking me what I wanted to do and kind of giving me some goals of the rotation, even though I was kind of on the other side, on the ortho side, just kind of talking through it and establishing those goals of a rotation really helped. So, even though we weren't directly working together, it was very appreciated nonetheless.
Yeah, absolutely. And that should be what we all do, particularly in the teaching centers.
Yeah, definitely. Maybe shifting over to kind of the end of the CaRMS cycle, more of the interviews and ranking side of things. Do you have any advice for kind of preparing for interviews? Now that they're virtual, is there any kind of Zoom etiquette and things like that you would recommend?
Yeah, there's actually a really good Canadian article about this. So if you want to put that in the notes of the podcast. Yeah. But a lot of the things are things that would not be surprising, right? Like make sure you have a good camera, make sure you have a good microphone, make sure your internet connection is sound. If you're in a home, and this is true of lots of our candidates, if you're in a home that is not conducive to that, chat with your med school about whether they can offer you a space for you to sit in. If you have kids at home, if you have parents at home, if you have folks, like if you're just not in roommates, right? If you're just not in an environment that's going to be conducive to an interview, then, chat with your med school about whether they can accommodate something. And then, you want your background to be something that reflects who you are, like whether that's a virtual background. So, today is not a good reflection, but my background is almost always bag end, right? When I'm on a Zoom call, because I'm a big Lord of the Rings fan. And so it reflects who I am. It's, very neutral. It's generally quite professional, right? Some people would prefer to have a blurred background. I comment to almost because I meet with all of my candidates, I comment on, it's so interesting, like 90% of people have plants in their Zoom background. I'm like, is this a thing that's out there in the world? And apparently it is. Apparently you're supposed to have a few plants at like different heights because it's visually appealing. But fundamentally, like what your background is up to you and what you are most comfortable with. And then the other thing that I would say that I have noticed, particularly in the last couple of years since we've transitioned to Zoom, is some of the candidates have like, I think, put Post-it notes around their monitor, which I think is fine, right? Like quick cues to remind yourself of things that you should highlight during your interview answer. The one thing I would discourage any candidate from doing is reading a pre-prepared answer. I think really what the interviewers are looking for is like a genuine, spontaneous response to the question that's being asked. And usually the thing that helps you do that is practice, right? So it's less about reading a pre-prepared response, but practicing answers to questions that you're pretty confident are going to be asked, right? Like, I think most people can be pretty confident that there's going to be questions about how do you communicate with people, right? And how do you collaborate with your peers? And what are things that have challenged you, right? Like those are questions that are universal. Like almost every program asks those things. And so it's better to sort of have an approach to questions rather than a pre-prepared answer that might not actually fit the question that's being asked.
Fair enough. Very valid. Okay. And kind of just as we're wrapping up here, do you have any advice to offer students when it comes to ranking programs? You yourself moved from Manitoba to Toronto for residency. Is there anything that drove that decision necessarily? And how can applicants kind of make sure that the city that they're going to and the program that they're going to is the best fit for them?
Yeah, it's a great question. The postgrad dean in Manitoba, so when we were applying for the match, had this really great slide, which I thought really encapsulated this whole dynamic. And the slide had like 30 different things that might influence a candidate's ranking decision. And everybody's ranking decision is going to be unique. So what does that mean? So for me, I'm from Ontario. And so coming back to Ontario was a priority for me. And so I had an interview for emergency medicine in Manitoba. Would I have been thrilled to do emergency medicine in Manitoba? Absolutely, right? Like Manitoba has fantastic pathology, amazing teachers. I'd been there for 4 years. I knew all the consultants. I knew all of the people who were going to be co-residents with me. But fundamentally, it was more important at that stage of my life to be closer to home than it was to stay in the center where I trained. But there are so many different things. There's like, do I have a family? Or am I about to start a family? Does it make sense to be closer to grandparents? Do I want to live in a particular city? Do I want to be able to travel? And so do I need to be closer to a hub? Am I planning on doing a lot of rural medicine when I'm done? And so do I need to be in a center that really facilitates that? Is there a particular type of research I want to be engaged in? And does that center facilitate that? So there are just so many different factors that influence people's ranking decision. The one piece of advice, I have many pieces of advice, but I think there's two pieces of advice that I would give any candidate. Number one, don't rank programs that you don't want to go to. The reality is if you rank a program, there's always a possibility that that's where you'll end up. And if you're going to be deeply unhappy at a program, don't go there. I love Toronto. I've had a really great time here. I trained here. I work here. I'm the program director here. But Toronto's not for everyone, right? It's a big city. It's got 3 million people. Some people do not thrive in that environment, right? So the last thing we would want is for you to come to our program and be unhappy here. And so if you know you don't want to go to a place, don't rank that place. The second is don't try and game the system. I think they're going to rank me highly, so I'm going to rank them highly. Don't do that. The reality is the match favors the candidate, right? And so, I'm going to use my own center as an example. Let's say you really want to come to Toronto, but you don't think you performed well in your interview. And on our side, we're didn't perform well, great on the interview, but we're still going to rank you number 25, right? If you rank us number 1 and we rank you number 25 and our top 24 have no interest in coming to Toronto, you're going to get to come to Toronto, right? Because the match is meant to favor you as the candidate, not us as the program. And so I would encourage you to rank the programs in the order that you want, not in the way that you think we're going to rank you.
Awesome. Yeah, it's good to know. And me personally right now, I feel a little bit not alone, but I feel like I could use that that favorability when it comes to the match. So
yeah, 100%. Yeah.
It's very good to know. Well, Dr. Pardhan, that's kind of all I have in terms of questions. Thank you so much for joining us.
Thanks so much for having me.
Wow, what a great conversation. I definitely learned a lot about my own applications, and I hope our listeners did the same. Once again, thanks for tuning into the Specialty Café podcast by the Royal College that enables you, medical learners, to choose your ideal specialty. My name's Mark, and don't forget to tune in to the rest of our CaRMS series.